Hi, my name is Cole Dixon, and this is Exercise and the Treatment of Depression. So just a little bit of background information. Through several studies conducted in the past few years, we have concluded many times that exercise and the symptoms of depression have a correlation. And that correlation is that both aerobic and anaerobic exercise can minimize the symptoms of depression. So while these studies have been able to find that there's a correlation between depression symptoms and exercise, it has been difficult for them to determine which specific forms of exercise are most effective. So the objective of the article that I'm reviewing is to determine the correct workout plan for someone diagnosed with depression. So methodology. To ensure that the studies were reliable, the studies were ran through something called the Pedro test. And basically, this test will give you a score to determine if a certain study is valid or invalid. And so before being used in this analysis, all the studies went through this test and passed. So these studies were also analyzed for many different things such as frequency, intensity, duration, type, and duration. So through reviewing 5 different exercise programs, the studies found that this program should be at least 9 weeks long. And they found that the most effective form of exercise is aerobic exercise, such as indoor walking, outdoor walking, or stationary cycling. They actually found that the most effective intensity would be low to moderate intensity or patient-preferred intensity. So it's worth noting that high-intensity exercise was not as effective in treating depression unless the patient were to prefer it that way. The most effective length for exercise was found to be 30 to 40 minutes, performed 3 to 4 times per week. So from the 5 studies that were included in this article, the intensity varied from patient preferred to 75% of the VO2 max. And so this was a pretty great variance, and the results between the studies concluded that patient preferred intensity was most appropriate and found the best results. The most effective exercise length, as mentioned before, is 30 to 40 minutes. And this is less than the National Institute for Health and Clinical Exercise guidelines. However, these discrepancies are expected since the determining factor in effectiveness for this study was related to mental health and not physical health. So the main takeaways of this article is that it has been proven numerous times that physical exercise can aid in minimizing symptoms of depression. 3 to 4 sessions of moderate aerobic exercises lasting 30 to 40 minutes over the course of 9 weeks seems to be the most effective form of exercise. And while this specific form of aerobic exercise is shown to be the most effective in clearing symptoms of depression, different forms of exercise may be more effective in maintaining or improving physical health. So some of the real-world applications for this article are that the analytical nature of these findings make it quite easy for healthcare staff to provide treatment programs for those diagnosed with depression. The finding of a patient-preferred exercise intensity being most effective makes implementation of this program a lot easier. Since the patients are not forced to adhere to a certain intensity level, there may be less drawback from patients. The findings of this study could help patients with mild or moderate symptoms in stopping the use of antidepressants in the future. Thank you.